I wish a very graceful and warm good morning to our beloved Principal, Professor M. Simakant Garu, convener of this webinar, Honorable Secretary cum Correspondent Professor K. Mutyam Reddy Garu, patron of the webinar, eminent speakers, present excellency, faculty, and all the delegates with great joy and immense exultation. On behalf of RBVRR Women's College of Pharmacy, I, Zeenat Banu, working as Assistant Professor in the Department of Pharmacology, feels privileged to welcome you all to the inaugural session of International Webinar on Pharmacy Practice, the Global Scenario, organized by RBVRR Women's College of Pharmacy, Barkatpura, Hyderabad. The theme of this webinar is to discuss the current global status of initiative relating to advancement of pharmacy practice. Pharmacy practice is a discipline of pharmacy which involves developing the professional role of pharmacist. The practice of pharmacy aims at providing and promoting the best use of drugs and other healthcare services and products by patient and member of the public. Thus, the welfare of the patient is the pharmacist's prime concern at all times. With this introduction, let's begin this program by seeking the blessing of Almighty by digital lamp lightning and with a prayer song.
या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीं अभयदां जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थिता वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम् या कुन्देन्दु तुषारहार.
Indeed, we felt blessed. It's my pleasure to invite our principal and convener of this webinar, Professor M. Simakant Madam, to officiate the program with a welcome note. I welcome you, ma'am.
Yeah. Thank you, Jeanette. Yeah, it's my pleasure and honor to invite today's eminent speaker, Rajesh Nayak Garu. All the delegates who got registered for this webinar, my dear colleagues and students. A warm welcome for today's webinar on pharmacy practice, a global scenario. In 2008, the PharmD course was introduced by PCA President, Professor Suresh Garu. The main motive to start this PharmD course in 2003 or 4, I think, whoever passed out, those students are eligible to register as a pharmacist other than India. So after that, the course was introduced as 6 years course. Why? Because these countries are allowing only those students to register as a pharmacist. So the motive to introduce the PharmD course to encourage the students, whoever are interested to pursue their studies as well as to work as a pharmacist in other than India. So that is the purpose of starting this PharmD course. So till that, we don't know that word itself, the pharmacy practice. So after introducing this PharmD course, I think the Masters in Pharmacy Practice course was also introduced. Uh, the purpose of conducting this webinar on this particular topic is to aware all the pharmacy students um, where they can get the career opportunities by selecting one of the subjects of the pharmacy. The pharmacy practice defines that in improving or developing the roles of the pharmacist in different disciplines which are the part of the pharmacy profession. So, with this international webinar, what we want to give to the pharmacy fraternity is what difference we can find the role of the pharmacist from India to the other countries. What we can say that is there any difference from developed countries to the developing country? So the motive is that one to start this webinar on this day itself by inviting the eminent professors from other countries. In India, till now, we know that as a pharmacy professional, so our job is only in industry or to open the medical shop. Still, it is going on the same wave. But even though it was started at PharmD course, maybe almost 18 years, I think not 18 years, 13 years back, till now we didn't know the term itself, the pharmacy practice. So, to know in detail about this pharmacy practice, how it plays a major role in developing the career in pharmacy. So, today we are conducting this webinar. In India, we know that only the community pharmacist, so which is nothing but the retail pharmacist. Other than that, the patient-oriented pharmacist is available. This we would like to aware the public that we are the pharmacist. We can take care of the patients. So these things, I think, most of the pharmacy professionals are trying to aware this type of slogan in the public, but till now it was not finalized. So somehow, as a principal of this college, as head of the institution, so somehow I would like to share my part in improving the career for the students in this pharmacy profession. So with this, I would like to conclude my welcome speech. Thank you.
Thank you, ma'am, for briefing about the webinar and sharing with us your words of wisdom. Now, I would like to invite coordinator of this webinar, Dr. J. Archana, ma'am, HOD, Department of Pharmacology, to address the gathering. I welcome you, ma'am.
Thank you, Jeanette. Good morning, one and all. A warm welcome to delegates and dignitaries to the international webinar on pharmacy practice, the global scenario. The current era of globalization has witnessed evolution in the professions of healthcare sectors, especially in pharmacy. Over the years, there is a paradigm shift of pharmacy practice from product-centric to patient-centric. The years which made the pharmacist more accountable for patient care. The healthcare needs across the world are increasing day by day. To match up this, today's pharmacists need to explore new dimensions in pharmaceutical care. According to WHO the prospective pharmacist must have basic expertise, attitudes, and behavior to support their positions. But the precise role of pharmacist in healthcare setting is altering and varies significantly from country to country. A lack of integration of practice standards across different settings indicates for a need to review the standards for relevance. Today, we are fortunate enough to have eminent speakers to elaborate and illuminate this area. I hope all of you can find this webinar informative and help to understand and learn pharmacy practice innovations, systems, opportunities, and challenges around the world. Let us move to the first session. Over to Jeanette.
Thank you, ma'am, for your valuable words. Now I request Dr. Shailaja, ma'am, HOD, Department of Pharmaceutics, to chair today's section. I welcome you, ma'am.
Thank you, Jeanette. A very good morning to one and all. It's my privilege and honor to introduce Rajesh Nayak, who is working as Associate Professor in the College of Pharmacy and Health Sciences at St. John's University, New York. He is a very great educator and researcher, having more than 20 years of experience. His field of interest are pharmacoeconomics, pharmacy management, and pharmaceutical marketing. Sir has completed his UG, B Pharmacy, and M Pharmacy from University College of Pharmaceutical Sciences, Manipal, that is from Mangalore University. He obtained his PhD degree in the topic of pharmaceutical outcomes and policy from the University of Florida. He is currently lives in New Jersey. Sir has published more than 100 papers in various international and national journals of high repute. Sir has presented various papers. He has delivered so many lectures in national and international conferences. Sir, along with his students, he acted as mentor and he guided more than 25 projects, UG projects, and he has involved in so many collaborative projects along with his colleagues in New York. Dr. Nayak held several positions. He worked as a director of graduate sciences in pharmacy administration. He is currently working as reviewer and editorial board member for several journals. He is also a regular reviewer of research for reputed journals like Journal of Managed Care Pharmacy and Specialty Pharmacy, the Journal of Clinical Psychiatry, Research in Social and Administrative Pharmacy, and the Journal of Pharmacy Practice. Dr. Nayak has received several awards for his work. He received University President's Medal for Outstanding Achievement at St. John's University. He holds visiting faculty appointment in Manipal College of Pharmaceutical Sciences, Manipal. He taught several pharmacy courses in Rome, Paris, and Spain. He used to teach courses such as pharmacoeconomics, pharmaceutical marketing, pharmacy management, US healthcare, managed care pharmacy, and pharmacy law, students in pharmacy Form D program, allied health and biomedical sciences, public health programs at St. John University, and also he used to deliver several lectures in other universities in abroad. He received his bachelor degree and master degree from India. So with this introduction, I cordially invite Rajesh Nayak sir to deliver his talk on Global Pharmacist, Opportunities and Challenges. I welcome you, sir.
Thank you, Dr. Shailaja, for that wonderful introduction and a very comprehensive one. Can I go ahead and share my screen at this point if I'm allowed to do that? Let me see. Just give me a moment. I will go ahead and share my PowerPoint and then I'll continue to talk. All right. All right. Well, hopefully you can see my PowerPoint. It just went up, at least from my end, and I hope you can see it from your end as well. Okay, I'm also using this microphone here, so hoping that I'm coming through clearly. Okay. All right. Okay. Good. Hope everything is in order. Like I was saying, I'm speaking from my home office. It's has midnight here in New Jersey, and I want to thank Professor Sumakant and also Dr. Archana, Dr. Shailaja, and then all other members of the organizing committee for inviting me. And I want to thank you for that, particularly because given the difficult circumstances today. And I also want to bring you greetings from St. John's University. We are a 150-year-old institution, a Catholic institution located in the heart of New York, the greatest city in the world. And I noticed that you have completed 15 years of operation and service yourself. So greetings from St. John's University, and I welcome you all to visit our campus online. We are a mid-sized university. We are a private university with about 22,000, about 21,000 students, about 17,000 undergraduate students, and about 4,000 graduate students. And we offer more than 100 programs in multiple areas of education, health, law, etc. And then we have also students like you, and then I'm assuming that there are a lot of students in the audience today. We have students from over 110 countries currently attending St. John's University. So greetings to you all from New York. I'm speaking from my home office, so hopefully the lighting is okay and then the audio is coming through clearly. So let me just go ahead and start my presentation. And I have about 35, I think, 35 slides. And I have already made copies of the slides available to Dr. Archana, and she'll be happy to share them with you. And I hope to take about 45 minutes to an hour, and then I'll open it up to question and answers, and then I'll be more than happy to answer any questions you may have about pharmacy practice here in America. And one of the reasons I was drawn to this webinar was when Dr. Archana approached me and said, we are holding a conference on pharmacy practice global scenario. The word global really caught my attention. And as you know, I'm also a pharmacist who was trained in India. So I'm in that sort of unique position where I have a good perspective of the Indian education system, the Indian training system, as well as the Indian pharmaceutical industry. And then also 20 years of experience working in America and then being an educator in the field of pharmacy. So I felt like this would be a great opportunity for me to talk about, the global pharmacy practice. And then once again, I thank Dr. Archana for inviting me to do this. All right, so let me first begin by giving you an outline for the presentation. One of the things that you will notice is that this is not a very technical presentation. I'm generally used to presenting on, research. The kind of presentation that I usually do involve, presenting data, numbers, and, research papers, things of that nature. But here it's a little bit different. So I considered it a challenge to do this presentation. But at the same time, I want to point out that this is a simple and straightforward presentation. It is sort of an overview of pharmacy practice in America, and it is sort of a simplistic and a straightforward presentation. What I'm going to do is give you a lot of examples of pharmacy practice models that are currently in use in the United States, and then I'm gonna maybe select a few of them and then share the details with you, with the hope that some of these models will be applicable in India as well. In other words, what I'm going to do is give you a lot of examples of pharmacy practice in the United States, and then see if we can try and translate some of these ideas, into pharmacy practice in India. So this is the presentation outline. So I'm going to start with the global vision for pharmacy, something that I obtained from International Federation of Pharmacy. And I'm going to also give you some information about the factors driving significant changes in pharmacy practice, factors and forces that are currently shaping not just pharmacy education, but overall the pharmacy and pharmaceutical industry itself. And then I'm going to, identify key opportunities, and 3 of them particularly. These are the trending areas in pharmacy practice, the ones that I'm personally familiar with, and then these also happen to be, for me, areas of research interest, and I've done research in these areas, particularly collaborative practice models. So I'm gonna just, instead of talking about all of them, I'm just gonna focus on 3 of them. and then tell you about our experience working.
Sir, excuse me,
Yes?
sir. Sir,
Please,
sorry
go
to
ahead.
disturb you.
Yes,
Sir.
yes, go ahead.
Sir, can you please make it a slideshow, sir?
Is it too small, or use the slideshow you made?
Presentation to the slideshow.
Okay. Yeah, I had a smaller version of presentation, and then because I can look at the clock and then not lose track of time. So is it better now, ma'am? Can you, I just made it bigger. Are you able to see it better now? Yes or no?
Complete, sir, from the beginning so that the screen will come big. Please select the entire screen, sir, so that it will be looking nice.
Okay. Are you able to see my PowerPoint? Okay. I changed the presentation mode again because I did not hear from you whether or not you could see the PowerPoint clearly. I'm going to try this one more time. And I'm looking at also simultaneously at the StreamYard YouTube link, and it looks like you can see it. Probably it's too small. Correct me if I'm wrong, and I'm going to try and make it big again. Yeah, I'm in the presentation mode now, and I hope you can see it. Can you tell me if you can?
So can you make it the entire screen? Entire screen?
Yeah, should I maybe reset it, stop sharing, and then try sharing again? Would that help? I just want to make sure that you're able to see what I am looking at on my screen right now. And that may not be the case because I'm not hearing anything from your end. So help me out here. Let me know if you're not seeing anything at all, or you're seeing something and not clearly, or is it something that I have to do from my end to make it look better?
So just click on to slideshow.
Do you want me to stop sharing for a moment and then try upload the file again and then see if that works differently?
Okay.
Okay, I'm gonna stop sharing.
Yes, sir. Now,
Right, let me try again. How about now? Is it better? Are you able to see the PowerPoint? How about now?
Yeah, it's okay, sir.
Is it better now?
Yes, sir.
yes, sir. Okay, sir.
Okay,
Please
good. All
continue,
right.
sir.
So sorry about that interruption. Yeah, a little bit of a snafu from my end, and I apologize for that. Let me continue. I was giving you an outline for the presentation, and I'm gonna address three key areas of growth, and I'm gonna focus my presentation only on those three what I call growth areas in pharmacy practice. And like I said, let me start with a vision statement from International Pharmaceutical Federation. And this vision statement was developed 3 years ago by this international organization. And instead of reading it word to word, I'm just going to put it on the screen and then maybe hopefully draw your attention to some of the words that I've highlighted in that vision. And then, as you know, for years now, pharmacy profession, not only in India, in other places, other countries as well, has been mostly product focused and science based. But it is changing, and it is changing rapidly everywhere. So the International Pharmaceutical Federation recently adopted this vision for pharmacy, sort of a global vision, which has a lot of things in it. And if you look a little closely, if you sort of hold this vision under the microscope, there are a few words that I highlighted for you. For example, things or words like demonstrate empathy, or strong interpersonal communication skills, teamwork and collaboration, safe use of medicines, diverse workforce, lifelong learning, and continuous changes. So when you look at this vision statement sort of in a nutshell, what you will also take from it is the fact that today the pharmacy has evolved to a point where we are no longer product focused. We're not only science based, but we are expected to be proficient in a lot of other things, such as interpersonal skills, being able to work as a team, being part of the diversity in workforce, and of course, at the heart of all of this is advancing safe use of medicine. So we are kind of held to a different standard, and in this vision actually reflects that. I wanted to share that with you as sort of a preamble to my presentation, because that vision is now being adopted but by all the major countries around the world. In the United States, for example, this picture that I'm sharing with you on the screen, an interesting one, but it's not exactly a new picture. It's about 4 years old. And the vision here is of that of a pharmacist who is kind of, branching out and going beyond the traditional, model of practice, in the sense, this article, if you can read it, I don't know if you can read all the words in it. It says non-traditional mechanisms to engage patients. So this picture here that you're looking at on the screen is of that of a retail store here in America called Walmart. Walmart. And Walmart has thousands of stores all over America, in Europe, and then I believe even in India now. So what you're looking at is a picture of a departmental store. It is also a part of a grocery store. And then part of this retail establishment is also pharmacy. Now, what you're looking at is not exactly a pharmacy, but rather a pharmacist. And this is in the general, garment section, the area where pharmacists are sort of setting up camps, where they do a lot of different things, and then offer clinical services such as testing, immunization, screening. Now, this is something that in India you may not be doing a lot of, and this is where the future is going to be for pharmacists everywhere. And then this also, at the same time, reflects the vision that I shared with you from International Federation of Pharmacy. Now, in this particular picture, you are looking at a pharmacist who is performing testing. All right. Now, pharmacists in this part of the world are involved in all kinds of testing. Testing, for example, diabetes or hypertension or cholesterol. There are pharmacists in retail setting who are trained to perform, bone density screening for osteoporosis. So let me hold on just a second, and I have a call coming from into the slideshow mode. And then it is right now in the slideshow mode.
Where slideshow you can select. Unmuting.
Okay, so I see that. Okay, can I continue? Yeah, can I continue, Dr. Rachna? You want to send me another StreamYard link, maybe? It looks like there's a little bit of a lag between what I have on my screen and what you're showing on YouTube. Okay, I don't know at this point whether I should continue because I'm not getting a response from your end. And there may be a technical issue here that I'm not aware of because we are seeing different things on the screen.
Sir, are you able to see the presentation slides? Sir, I am going to share your presentation in full screen way. So what is driving all the challenges? That slide I kept. So are you
what
going
seems to
to
be the
continue from
problem?
the same slide?
I can continue from the same slide, but there seems to be some disruption that's technology related. I mean, I don't know what the problem is because I'm trying to show the full slide and then from your end you're not seeing it.
I am sharing, sir. No issue. I am sharing. You continue the presentation. Whenever the slide has to be changed, you just tell next so that I can go next slide. That's what I would like to tell.
So,
I'm going to share your presentation, sir. Are you able to see the presentation slide, sir?
yeah, are you streaming this
On the
live right
screen?
now, or are you just taping it? Because it's probably not a good idea to stream this way because it got interrupted quite a bit. So what we can do is maybe we can start from this. I know we can probably have to reschedule this because I know we're running out of time. So this is probably not the best way to do it. I want to have the control of slides from my end, but for some
Now,
reason,
as I am going to share the screen, you cannot control the slide, sir. You have to tell next so that I can move to the next slide.
Okay, so that's where you are at right now. Okay, let me see what I can do. So this is not something that I'm familiar with, not something I'm used to, but I will.
So please tell me from where I have to start, sir. Global SIP, Global Vision of Pharmacy.
So can you go back to that picture that I showed you before? Picture of
Presentation outline.
the health screening in a pharmacy, because I was describing that, and I wanted to sort of give a picture of how pharmacies perform health screening procedures in local retail stores. Yeah, that's the one. Okay, good. So let's see if I can work with that. So it's all good. So can I continue?
Yes, sir, you can continue.
Okay, so I just want to go back to the part that I was describing, and what you're looking at on the screen is a Walmart retail store, and then you are also looking at a pharmacist who's performing testing. Like I was saying, pharmacists in this part of the world routinely do testing in multiple areas of pharmacotherapy, meaning, for example, diabetes, hypertension, osteoporosis. So this is, it says the pharmacist of the future, but the future is already here. And this may be something novel, particularly in India. If pharmacists in India haven't been doing this, this may be the way to go in order to expand the reach and the scope of practice. Consider, for example, in India, retail stores like DMart or Reliance Retail. And something similar is already happening here in Walmart and Target and similar major stores where pharmacists are coming out of their stores, coming out from behind the counter. Because in a typical store like this, what you're looking at is a garment section, but then there's also electronics, and then there is grocery, then everything else, and then there's part of this, huge store is also pharmacy. Pharmacy is usually is located way in the back. All right, so pharmacies usually don't come out of the store. So what we are instead talking about here is pharmacists not working from behind the counter, but emerging from their store and attending to the customers and patients and offering them services that go beyond just dispensing. Because in retail pharmacy, when you think about retail pharmacy practice, most people think of pharmacists wearing a lab coat and dispensing medication, counting pills, putting labels on a bottle, and not really interacting a lot with the patients, right? Now all that is changing now. The new practice model is something like what you are seeing in the picture. So can we move on to the next slide, please? Okay, so what is driving all the changes? Next slide, please. Well, I have listed 8 factors or forces driving all the positive changes in pharmacy practice. And there's 8 of them, and they're all important. And then it's not like one is more important than the other. Educational transformation, evolving skill sets, workforce changes, changing demographics, expanded scope of practice, transition from product focus to service orientation, and novel drug discoveries and innovation. Now, there may be more. This is not a complete list, but when I set out to do research on this, and I looked at all the variety of forces and factors out there, all the developments around the world that are contributing to the evolution of pharmacy practice as we know it today. Those are the 8 things that really stood out for me, and then I'm going to maybe pick 3 or 4 of them as being perhaps more important and most important than compared to the other ones. And then the number one thing that I would want to rank, it's number one, significant change is change in the educational system itself, which I listed as number 1, educational transformation, PharmD curriculum. Now, Professor Sumakan, Principal Madam, was just talking about how, because of the need of how pharmacists in India had to be trained for a career not only in India, but be able to work as a registered pharmacist in foreign countries, for example, in America. So the educational transformation is already taking roots in India, and it is happening elsewhere as well. PharmD curriculum is becoming pretty standard everywhere, and they may not call it PharmD like in India or in USA, but they may have a different name for it. But when you talk about transformation, essentially you're looking at an education granting system where you're moving from 4 years bachelor's to 6 years, advanced pharmacy training. So in many countries right now, a bachelor's degree in pharmacy and an advanced degree in pharmacy are 2 different things. And in many countries now, you're looking at 5, in some places 6 years of professional training. And then it is, like I said, happening in India also. And to go along with these so-called transformation in the educational system, the skill sets that pharmacists in the future are expected to acquire. And I broadly classify the skill sets as curriculum based. These are things that the skills that you acquire when you're in school, and co-curricular skills. These are the skills that you acquire when you're still in school, but these are not necessarily part of the curriculum. They are more like attached to the curriculum, something that you may be doing outside of the classroom. Co-curricular skills, for example, picking up interprofessional skills or picking up leadership skills, because there is a lot of skills that you could, acquire through textbooks, through, learning in the classroom, by attending lectures or seminars or webinars like this. There is that, but there is also skills that you acquire hands-on by being out there, by, interacting with other healthcare professionals, for example, like nurse practitioners or nurse midwives or physician assistants. Now, some of these, the ones that I just mentioned, now everyone in India knows who nurses are. But when you in America, there are the so-called allied health or paramedical professionals that come in many forms, such as physician assistants or nurse practitioners. So think of them as also specialized providers of healthcare that are not physicians. Okay, so one of the things and it changes that's happening a lot in curriculum across the world is teaching future students how to work as a team and work with other healthcare professionals. So these co-curricular skills are as important as curriculum-based skills. Then there are practice-based skills. Okay. Now, these are skills that you learn after you graduate. So, broadly speaking, there are skills that you acquire when you're in school, and then there are skills that you master, after you graduate. And then all of these skills are important. Workforce changes, enhancements in training and qualification criteria. Now, I do not know how much progress India has made in this regard. I'm talking about postgraduate training, post-pharmacy education after you get a degree such as PharmD or even bachelor's degree in pharmacy as in B.Pharm. There are additional degrees, and I'm not talking about graduate degrees as in master's degrees. Instead, I'm talking about postgraduate training, certification, residency. And then those are the so-called enhancements as part of training. So if you think about pharmacy today, it's not over once you graduate. It's lifelong learning. And I remember the vision that I just shared with you from FIP. So when I say lifelong learning, even after pharmacy school, you are still, earning those necessary skill sets, and then also additional training through residencies, fellowship, training in research, certification. And all of those are important. And those things, some of those will be coming to India as well, I hope. Changing demographics. And then this is something that I want to emphasize. And I listed as maybe one of the top 3 or 4 drivers of changes in pharmacy profession, demographic changes. Now, some of the changes are observable, some are not. For example, here and in the United States, in many states, the population is changing demographically. People are living longer, and then it's turning more multiracial, more multi-ethnic. So there are changes related to demographics, such as age, race, gender, where people live. The composition of the demographics itself is changing. And the point about that, with the demographics change, pharmacists have to adapt as well. Social determinants of health, something that at least in this part of the world, the professionals are talking a lot about, again, in a demographic context. So things like, education or sociological factors, those are important as well. And if you're wondering, what does pharmacy have to do with any of that? Well, you have to keep in mind that when you are serving a population, okay, that is multi-ethnic, for example. The patient needs are different depending upon who they are, where they come from, what language they speak, and then all of that is, so then these are demographic changes that we have adopted. Importantly, in pharmacy schools everywhere, not just in India, uh, is something about changing demographics also should be focused on, and it should be part of the training itself. And one of the things that I mentioned under workforce changes is a phenomenon called the pharmacy deserts. Pharmacy deserts and having to do with supply versus demand. And again, this is something that's observed in mostly developing countries because of demographic changes, where people are moving to suburbs, people are moving to cities, and rural areas are becoming less and less populated. So, what kind of problem does that create for people who live in rural areas and villages? Well, they may not have adequate access to pharmacy services. So, pharmacy deserts is a problem, and it is a demographic problem as well, and it may be workforce related also. Now, pharmacy desert is a phenomenon where uh, people do not have access to pharmacy services or a simple access to a retail pharmacy. For example, one may have to drive 25 miles to get to the nearest pharmacy, and then there are pockets or regions like that exist here in the United States, and maybe in India as well. So, as far as the penetration of pharmacy services is concerned, we are not there yet, and particularly in areas where our expertise is needed, and we are not being able to provide some key services in pharmacy deserts. Now, an interesting fact about pharmacy penetration in the United States, about 95% of the population lives within 5 miles of a retail pharmacy. Let me say that again. 95% of the population lives within 5 miles of a retail pharmacy. So we are pretty well covered that way, but there are still 5% of the population that are not able to access pharmacy services, and then that may be equally true in India as well. So moving on, I'm gonna cover a couple more instead of going through the entire list because we lost some time and I want to finish on time. One of the things that I want to focus on today is the so-called expanded scope of practice. And the reason I picked that as a focus area is because this is something that I feel in India, by way of educational transformation or as a practice model, it's something that Indian pharmacists can readily and quickly adopt. Now, expanded scope of practice. Now, what does that mean? Well, it means pharmacies going beyond their traditional practice. And then a traditional practice is one where pharmacists, like I described, standing behind the counter and dispensing medications and not having a lot of interaction with the customers or patients. And then that's how it is in India mostly. If you walk into a medicine shop, right, or call it medical shop, a retail pharmacy, so you don't really talk much to the pharmacist, where you just maybe present a prescription or tell him what you need, and then he will just bring it to you, and that's it. That's the end of the interaction between a pharmacist and the patient. Now, in expanded scope of practice, it goes beyond that. There are extra things that you are expected to do, and then also in many states, you are legally allowed to do, such as, for example, performing collaborative services, clinical services. What do I mean by that? When I say going beyond the traditional model of care, collaborative as in working with physicians, taking care of the patient and being involved in the active supervision of patient care, and then you're working actively, okay, with a physician or a doctor. Okay, that's an example of a collaborative model. It is also an example of expanded scope of practice. So it simply means when you do extra things, when you do, when you perform high-level specialized services, such as, for example, counseling. And I'm going to show you some examples of that that pharmacists here in the United States do in hospital setting, in outpatient clinics, in retail setting, in nursing homes, everywhere. And then there are some like 85,000 pharmacies, 85,000 pharmacies all across the country. And more than half of them are in all these diverse, practice settings. And more than half of all the pharmacies are currently involved in expanding their scope of practice. So, and this is something that I feel we should talk a lot about in India as well, because we are ready for it. And one of the foundational aspects of it, in order to do something like this, is the educational transformation, which is already happening in India. So we are ready to expand the scope of practice in India. So I'm gonna give you some examples of pharmacies involved in public health advocacy, particularly immunization. And let me skip a couple of things here. I'm gonna move to the next slide. Can we switch to the next slide, please? Areas of opportunities, evolving roles of the pharmacist. And I listed again 6 of them, and I'm going to focus on 3 of them because, like I said, all the 6 are important. But if I have to prioritize and I have to pick out only the most important ones, those are the 3 that I will select. Public and population health, health informatics, and evolving collaborative practice models, as in expanded practice models. All right. So what are other things? Now, drug information, for example, something that is very familiar, I hope, to pharmacists in India, because we've been doing this for, particularly in a hospital setting, forever. Career in research in clinical pharmacy, something that I'm not going to focus on much, because much of the educational system in India prepares you for that. As in career in industry, maybe in quality control, maybe in sales, maybe in manufacturing and production, or maybe in regulatory affairs, right? So I'm not gonna, and even economics, as in HEOR, health economics and outcomes research. These are all different research options that are out there that are available to pharmacists everywhere. But the 3, again, that we will focus on are the 3 that are highlighted. So let me go through each one and then spend a few minutes giving you examples for each one. The first one is public and population health, pandemic care and immunization. And the second one, health informatics, so everything to do with the technology. And I thought it would be relevant, in an Indian context as well, because as you know, and then everyone knows this, in India, we are very proficient when it comes to the use of technology. Right, and there is a lot of talent, and then there is tremendous, resources and talent available in India, and that's something I think as pharmacy we should capitalize on. So health informatics is one area that I have developed a lot of interest in, and one in particular called telehealth, which is spreading fast. And it is being adopted rapidly by not only pharmacists, but all other healthcare professionals as well. But this is a tremendous growth opportunity, a trending area for pharmacists as well. So I'm gonna give you some examples of health informatics, particularly in reference to medication adherence. And the last area of focus, evolving collaborative practice models. And if you have time for that, we will cover that as well. But let me go to the next slide and share with you something that I received on WhatsApp the other day from one of my friends who is also a pharmacist. And then I just wanted to share this with you. Can we go to the next slide, please? Case in point, something interesting about pandemic care. This is from International Journal of Research in Pharmaceutical Sciences, an interesting article that appeared about Ayurveda, Agnihotra, and I'm not going to talk much about it because I really honestly don't know much about any of this, other than I know I have heard of Ayurveda. But for point of this, here is an interesting piece of research that is carried in a reputed journal, International Journal of Research in Pharmaceutical Sciences. Can we move to the next slide, please? Because I'm still looking at the old one. Yeah, I'm sharing with you this article that appeared sometime last year, and me and my colleagues were just having a conversation about it. Now, how is this directly relevant to pharmacists? Now, it doesn't really talk about pharmacists at all. If you read this article, and then there is a link provided at the bottom of the screen. You can always click on it and then learn more about it yourself. But as an Indian, this is a popular healing system in India. Has been ancient, has been around for ages. But interestingly, the Western medicine is finally giving it all the attention it deserves, giving it recognition, and a mainstream journal is now carrying a research about Ayurveda and Agnihotra. Now, the point that I want to make about this, and I said a case in point, something interesting about pandemic care, pharmacists everywhere are currently involved heavily in pandemic care. And some of these pharmacists are using expertise that they acquired outside of the classroom. And here is an example for Indian pharmacists. Indian pharmacists who deal with on daily basis, plant-based products. And then the one that comes to mind is the popular, Indian brand Patanjali, right? Everyone knows Baba Ramdev's Patanjali products, right? And many pharmacists sell them. And then what if I told you that pharmacists may actually get involved in something like, dispensing and delivering this interesting class of products, which are sort of new in this part of the world, not so new in India. Right? In India, we've been seeing these products all the time, but when an international journal like this carries an article, it kind of draws everyone's attention. And this form of therapy, Ayurveda, it's not very popular in the United States, but it is sort of gaining traction because there is more and more, knowledge being acquired, more recognition, and soon here in the United States and elsewhere, this might become mainstream. So my point about this, if you're a pharmacist, you have to be prepared to kind of expand your comfort zone, expand your domain, and go beyond the traditional, discipline of pharmacy, and then also, get get familiar with something like, Ayurveda and Ayurvedic products. And then the point, like I said, I was trying to make about that is pharmacists everywhere are adopting. The landscape of pharmacy practice is changing, and then changing rapidly and in a major way all over the world. Okay, so let's talk about the practice area. The first one, area one, public and population health. For your benefit, I'm gonna, I added a definition because there is often a confusion. Can we move to the next slide, please? Practice area one, public and population health. Here's a definition for public health, because there's often confusion about, what's population health and then what's public health. Now, strictly speaking, they are kind of interrelated, and one is a subset of other. Public health is a much broader discipline that is focused on community health, but it is geared towards disease prevention and disease detection. Now, an offshoot of public health, you can call it a subset or sort of a new focused discipline within public health called population health. Now, the reason I'm mentioning population health to you is because, again, in America, everyone, in pharmacy, the pharmacy is now beginning to learn more about population health, which is primarily outcomes focused. Now, I highlighted the last sentence there for you. Population health is, the goal of population health is to improve health outcomes, whereas public health is all about disease detection and injury prevention. Now, there is no consensus definition for it, and this definition that I'm sharing with you is from the premier public health agency called CDC, Center for Disease Control, here in the United States. So this is sort of like an operational definition, and the one that's going to soon become popular, not only in North America, but Europe, and then hopefully soon in India as well. Now, as part of public health, one of the areas that pharmacists are are actively involved in. And here is something that I did to prepare for this presentation. One of the things that I did, and then I've been working on this for a while, and I wanted to make a list of all the different experiences and different stories that pharmacists during the pandemic, because as you know, many of us have been working from home. And, the most of 2020 last year, about 90% of the time, I was working from home myself. So I was not in direct student contact. So one of the passions for me, besides teaching pharmacy, was also researching, all the things that pharmacists were doing during the pandemic. And then some of them, were actually also just like me, working from home. And then some of them were, required to be, on site, such as in hospitals or nursing homes or other places because of the pandemic. And what I did over the, several months, beginning sometime July of last year, I started collecting stories, all pandemic related and public health related, and maybe population health related as well. All the different stories of, pharmacy experience, and all the, the experiences that they share themselves in journals and media and social media. So I actually prepared a list of different things that pharmacists did during the pandemic. Now, this is very specific. All these activities that I've listed, that pharmacists in 2020, and some of them are still doing it in 2021. We are already into the fourth month of the new year, and pharmacists are going to are continuing to get even more involved than before in pandemic care. Now, on this list, there are a few that are highlighted, a few words that are highlighted. For example, pharmacists working as infectious disease specialists, as drug information pharmacists, and critical care pharmacists. Now, if you look at all these examples, you might think, oh, well, what's new here? Well, some of these things are not new in the sense this is something that pharmacists have been doing at least for a good 15, 20 years. All right. But what the examples that I have shared with you, and then if you go through all the little details there, okay, and then you actually have to read each one of these. And then if you move on to the next slide, can we go to the next slide, please? Pharmacists working in hospital ERs, emergency rooms, working as drug information pharmacists, working as critical pharmacists. Move to the next slide, please. Ambulatory care, medication specialists, operational logistics, post-discharge medication management. And these are all different examples of pharmacists. And then you see telehealth also being mentioned there. These are some things that are new. These are some things that pharmacists, adopted themselves. And many pharmacists during these stressful times were creative, and some of the methods that they use in order to deliver better care. And we're talking about a time when many pharmacists were either infected themselves or were not able to attend in person, and then some of them didn't want to work directly with the patients. So there was a critical shortage of pharmacists all over the country during the pandemic. So with whatever the resources, limited resources that we had in hospitals or in clinics or in retail, everywhere else, pharmacists kind of designed their own methods and treatment approaches in order to deliver patient care. So there are a variety of examples, dozens of them. Drive-through clinics, for example, or PPE stewardship and managing operational logistics and offering telehealth services. These are all relatively new things, and some of the new ideas that pharmacists during the pandemic adopted successfully, I might say. And some of these things are going to soon become standard. Now, I'm going to talk a little bit about immunization as part of public health. Can we move to the next slide, please? Immunization, why pharmacists? Thank you. All right. Here is something that may be of interest to you. And again, I had a conversation about this with my colleagues in India. But before I share that information with you, let me just give you a little bit of intro to what pharmacy immunization is all about. First of all, everyone understands what immunization is. I'm talking about immunization services that are delivered in a pharmacy premises or in a store, as in pharmacy store. It could be also in a clinic setting, such as hospitals, but essentially what we're talking about here is expanding. Remember the expansion of scope of practice. So this is an example of pharmacists expanding the scope of practice, going beyond the traditional dispensing tasks and performing a specialized service such as immunization. Now, one of the things that might be of interest to you that you may want to know is that pharmacy practice in the United States is regulated by states. Okay, there is really no federal regulation as in federal laws or statutes that govern pharmacy practice. So we have 50 different states, 50 different jurisdictions. So each one is different. Each one have their own laws for pharmacy practice. For example, I live in New Jersey. As a pharmacist, I follow New Jersey law, and I work in New York. So I have to follow New York laws when I'm in New York. So one thing that is, however, common in nearly all the states in America is for about 15 to 17 years now, pharmacists everywhere have been given a legal authority to give shots, vaccination. That's what I'm talking about. Again, different states might do differently in terms of different vaccine protocols that are adopted. Say, for example, the New Jersey vaccination protocols are different than protocols in New York. But one of the interesting findings, and this is something that I learned recently, when you look at other countries, there are 36 countries, and we're not the only one. When I say we here in the United States, we're not the only country, but we've been doing this longer than most other countries. There are 36 countries and territories where pharmacies are being utilized heavily for immunization. And about 1.8 billion people are currently taking advantage of pharmacy immunization all over the world. There are 26 countries where pharmacies are legally authorized to perform immunization services. So there's those details. And then there is a recent study that I came across, which essentially said when pharmacists are part of the team that does immunization, okay, just a simple act of utilizing pharmacies as immunizers may significantly reduce the time it takes to immunize the entire population. So there was this interesting study that was done by the CDC affiliated group of scientists recently, and then that study is cited at the bottom of your screen, which said if you use pharmacists for vaccination purposes, it actually reduces the time it takes to vaccinate the entire country by about 7 weeks. When I say, entire country, about 80% of the population, okay, can be covered with 7 fewer weeks spent doing it. So herein lies the value of pharmacists, and that's what I'm trying to emphasize. So pharmacies are already performing immunization all over the world. But now, given the pandemic situation, can we move to the next slide, please? I do not know if you have the next slide on. Yeah, the next one about pharmacy-based immunization coming to India. Now, I'm sure you know more about this than I do. Okay, well, the time now is about 1:47. I just want to check with the organizers to see if it's okay if I continue. So I think your time right now, I spent about an hour. Already, but we lost some time because of the technical issues that we had. But I want to know from the organizers if I
Yes, sir.
if I should
Yes, sir.
continue.
You can continue, sir.
Okay, thank you for that. Yeah, feel free to stop me, cut me off anytime, because I don't want to cut into your plans for the evening in the afternoon. All right. Yeah, this is something that I wanted to share with you desperately because I had a conversation about this with my colleague in India, and then I asked him, what's going on the immunization front in India? And then he said, it is coming to India. And I said, what do you mean? I mean, it has never been there. And here is what I have for you. This is from pharmabiz.com. Okay, you can look that up yourself. It says government to include pharmacists as healthcare workers in various health programs, including COVID-19 vaccination drive. Okay, I thought this is really interesting, and I wanted to share with you. Again, and I'm guessing that some of you may not know, and this may be already happening, by the way, because this news appeared sometime last year. So the original plan, if you look at the next slide, it's a pharmacy immunization in India. It says India may deploy pharmacists to administer COVID-19 vaccine report. Go back, yes. So if you read this article closely, the plan is to, if I can make this bigger, let me see if I can try. According to this report, which cites an official, India has enough trained vaccination now to administer the first shots of the COVID-19 vaccine to the first 3 crore people. But we need more vaccination as the government is targeting 30 crore shots by June 2021. So in about a couple of months, if everything goes as planned, because I don't know if they have put this into action yet, but this is the news that I got, and then I do not have any update on it, so you can probably educate me more about this. But it appears that India is making necessary changes and also utilizing and also employing their pharmacists now for vaccination purposes. And then it is not an easy thing to do, because there is training aspect to it, which has to be kept in mind. So this is something that I thought you might like to know. And feel free to update me on this news, because I'm really keen to know whether pharmacies are already doing this in India. All right, so that was about immunization. So the summary of it is, as far as public health is concerned, as far as population health is concerned, okay, the first area of priority, pharmacists here in the United States are already and actively involved in immunization. For example, just to share with you some numbers, today I was just looking at, COVID numbers here in America, and I was just talking to Professor Sumakant about this as well, the principal, and I was just telling her things are getting worse in America, particularly on the COVID front. We have about more than 500,000 positive cases of COVID. Okay, that's more than anywhere else in the world. So we're number one when it comes to the number of positive cases. Sorry, positive cases is 30 million. The number of deaths is about 500,000. So you can sort of imagine the nature of the problem that we have. So there's all the more reason for us to use our pharmacists more than before, more than certainly what we did last year. Now, the good news is that there are at least 3 different vaccine products that are currently available in the United States. Just like how in India you have Covaxin and Covishield, is it? We have Pfizer, Moderna, and Johnson & Johnson vaccines. There's 3 of them. And as of today, I was just checking the number, about I would say about 20% of the population. The current population of the United States is about 330 million people. So 20% of that, nearly 65 million people are currently fully vaccinated. So that's great news, but we still have 80% more to go. So given what we know about what pharmacists have to offer, given their expertise in this area, it makes sense, a lot of sense, for not only here, but also in India, to use our pharmacists for immunization services as well. Can we move to the next slide, please, about telepharmacy? All right. Yeah, here's area number 2, practice area, health informatics, telepharmacy. ASHP, that's American Society of Health System Pharmacy, defines telepharmacy as a method used in pharmacy practice in which a pharmacist utilizes telecommunication technology to oversee aspects of pharmacy operations or provide patient care services. Rather a simple definition, but I want you to, look at the next paragraph, because that's where really I think the heart of the matter is, because telehealth telemedicine have been around a long time. Now, telepharmacy, however, is sort of new. Okay, it's relatively new. And it wasn't popular for a simple reason. One had to do with the technology adoption, and we didn't have adequate technology in that area. And the second reason was, as you know, here most healthcare is covered by health insurance, unlike in India. And then, in India, I was just reading, only about 43% of the population is currently covered by health insurance. Only 43%. Okay. In contrast, in the United States, that number is more like 90%. Okay. So one of the challenges going forward for pharmacists and healthcare providers, particularly in this telemedicine or telehealth domain, is all about how do we get paid for this? Because yes, there is technology-related challenges, and that is continually changing as well. And every year, it seems every week now, there seems to be new technology that's coming out. Then there is challenge of reimbursement. Now, who's going to pay for this? But because of the pandemic, this telehealth, telepharmacy, telemedicine, whatever you want to call them, they are becoming extremely popular. And I picked as one of the areas that might be truly applicable in India as well. Again, because of the technology talent that we have, all the wonderful computer engineers and their programming skills. When you consider all of that, and when you look at this world of medical apps out there, like the Android and the Apple, the iOS apps that you may be familiar with, much of that innovation is honestly coming from India. So pharmacists, healthcare providers here are depending on Indian talent as far as the technology of this is concerned. So if we can do it here, why can we not do it in India, right? So that's more like a footnote to it, but there's also the point that I want to make about this. So telepharmacy operations, as far as pharmacy services are concerned, right? What kind of things are currently being offered as part of telepharmacy? That is, again, assuming that we have the necessary technology and health insurance covers it. So the services that are covered are things like drug review, monitoring, dispensing, sterile and non-sterile compounding verification, medication therapy management, patient assessment, patient counseling, clinical consultation, outcomes assessment, decision support, drug information. Now look at all the range of services that pharmacies are currently involved in, offering via telepharmacy services. And telepharmacy currently is recognized as one of not only the trending, but a growth area with tremendous potential, economically speaking. Last year in 2020, the market was worth about $3 billion. Okay. That's a huge number. And then it is about 13% of the 22 billion telemedicine market. So telepharmacy is a substantial part of telemedicine. Now, here is what is happening. I mean, this is really the big picture. And then this is, happening in India as well, I'm sure. Last year during the pandemic, throughout the year, many hospitals suspended, all the regular surgical procedures and in services. So, for example, elective surgeries were no longer performed because the priority for hospitals was COVID and coronavirus related hospitalization. All right, so much of the hospital resources were directed at that. Unless it was an emergency, unless you really needed immediate care, most hospitals actually turned their patients away. Only COVID patients were seen in many of the healthcare organizations here. And then that created a sort of a unique problem for hospitals. For one thing, there was a shortage of personnel. Like I said, there is shortage of pharmacists, shortage of nurses, shortage of even doctors, primary care doctors. And this shortage existed even before the pandemic, but the pandemic made it actually worse. So one of the reasons that telepharmacy became popular was because suddenly there was a shortage of professionals of all different kinds. And technology was the only means of not only communicating with the people, but also delivering clinical services to them. And you might say, well, how is it even possible to treat a patient, long distance or through video conferencing or using medical apps? No, those are some of the details that are yet being worked on. We don't have all the solutions to the problem. But what I'm trying to say here is there is a growing use of telemedicine in pharmacy, particularly in areas of medication adherence, remote counseling and medication management, remote medication surveillance, and medication reconciliation as in MedRec. Now, these are currently the areas that are being explored as possible, as potential options for telepharmacy. And many pharmacies currently are already doing it, but it is not widespread yet. But again, this field is continuing to grow. Can we move on to the next slide, please? So here is what's happening with the telepharmacy again. Without the pandemic, aggressive rollout of telepharmacy would have taken years. See, as bad as pandemic might have been, okay, well, there is a little bit of a silver lining to it, a little bit of upside to this terrible pandemic, once in a lifetime kind of a, negative event that we have all witnessed all over the world. It's not been a pleasant experience for anyone, but from a practice standpoint, and specifically with respect to telepharmacy, it has opened new doors to pharmacies everywhere, particularly here. And I give you, a bunch of examples where pharmacies could actually do it. Now, we have to thank the pandemic for the aggressive rollout of telepharmacy, which essentially means now more and more healthcare organizations or even agencies such as CDCs are embracing the idea. They're adopting the new treatment approaches, and they're also issuing guidance and guidelines. And then, for example, CDC recently issued guidelines for pharmacists and pharmacy technicians in community pharmacies during the pandemic, which essentially gave them additional authority to perform chronic disease management services. Now, this is a wonderful thing, and I'm talking about a situation where a federal agency such as CDC, okay, now is saying we're going to need pharmacists more than ever, and we're going to allow pharmacists legally to perform, additional and what I call the special or expanded services. And during the pandemic, this happened a lot. Agencies, regulations, statutes, etc. Okay, laws were changed in order to give pharmacists more power to do vaccination during COVID, for example, all right, to perform disease management services for chronic diseases particularly, and offer medication management services. And then all of this was possible because of the pandemic. So don't get me wrong, as terrible as the pandemic was, it truly created opportunities for pharmacists for now and also for the future. Because once we adopt this model successfully, once we find a way for health insurance companies to pay for it, something like this would be here to stay. And this is true, as much, in the USA as it is in India. So many states have rules and rules concerning the delivery of telehealth services, and then that's happening. And that's about telepharmacy. Here's an example of using telepharmacy to prescribe controlled substances during the pandemic. Now, I'm not going to get into the details of it. I'm just going to give you a snapshot of what's happening. And this is a key example of how pharmacists are able to do more than what they could do legally before. Now, controlled substances, if you don't know what they are, think of them as these powerful sedatives and hypnotics. These are narcotics, okay? The morphine containing or, the powerful muscle relaxants and the things that you're familiar with from your pharmacy school. In pharmacology class, perhaps you learned about, these powerful medicines. Now, there is a tremendous restriction when it comes to these controlled substances. And that's probably true in India as well. And there are safeguards, there are restrictions, there are limits. So all kinds of systems in place in order to make sure that these substances are not diverted or not used for illicit purposes. So during the pandemic, however, CDC issued new guidance that allowed pharmacists to remotely process prescriptions electronically. And CDC also allowed, and then if you take a closer look at it, there are two parts to it. One is the physician part, and the other is the pharmacist part. Can we move to the next slide, please? One about prescribing controlled substances during the pandemic. I have that flow chart on the screen. If you can, yes, thank you. Yeah, this is the part that I was describing. And then the CDC, Center for Disease Control, recently allowed pharmacists, they relaxed the rules, and then now pharmacists can electronically. Now, electronic prescribing and electronic dispensing, electronic prescribing is coming to India, and then I've heard about that. I don't know how popular it is, but in the United States, electronic prescribing is pretty standard. Most prescriptions that are dispensed today are processed electronically. That means no longer is it required for patients to bring a paper form of a prescription to the pharmacy. Instead, the doctors can directly transmit the prescription information to the pharmacy that patient chooses, a pharmacy a patient chooses, and then they just have to tell the doctor that they need the prescription sent directly over to the pharmacy of their choice. And more than 90% of all prescriptions that are dispensed today are processed electronically. Now, some like this may be already happening in India, but controlled substances, that's what I'm talking about. And then that's one area where there are a lot of restrictions, and those restrictions are either being removed or relaxed during the pandemic, in order to make these medicines more available, more accessible. All right. So again, this is an example of telepharmacy, where pharmacists are given the privilege of dispensing controlled substances pursuant to a prescription that is processed electronically. All right. Can we move to the next slide? And I'm gonna. It's 2:05. Again, let me know if I should stop here, because I know we have only about 10 minutes. I want to save some time for Q&A if I can. One thing though, I want to just, if I can have a minute or two, medication adherence, and then let me give you the definition for it and why it is important, and why I chose that as an area, a trending area, and also an area of future focus. That's because medication non-adherence is a significant problem in the United States. It costs about $100 billion every year. $100 billion. And then just to put that number in a perspective, I want you to think about how much India, for example, spends on prescription drugs, and how much America spends on prescription drugs. In USA, the cost of prescription drugs, the spending, the total expenditure is about close to $400 billion. And I read on the internet that India has just managed to crack $40 billion mark. So in a dollar equivalent, the value of all the pharmaceuticals that are sold in India are worth about between 40 and $50 billion. Now, that should tell you something about the cost of medications. But if you consider the impact of medication non-adherence, okay, this non-adherence problem, which is simply, if you want to know what non-adherence is, simply think of it as a problem where patients are not following doctor's directions. When prescription medications are not taken as intended or as instructed, that could lead to problems. And there are a number of reasons why patients may become non-adherent. And can we move to the next slide quickly? And I'm going to show you a couple of research studies. And can we move to the next slide? Yeah. Here is an example of medication non-adherence. When people don't follow instructions or directions of the professional, like the doctor or the pharmacist, this is what happens. And then this is from a research study that was conducted about 7 years ago by NCPA, National Community Pharmacy Association. where they did a survey of people who were taking medications of all kinds, and many of them were non-adherent to medications, and they asked them the reasons for non-adherence, and then these are some of the reasons that were cited. The most frequently cited reason was they forgot. Okay, they forgot, or they ran out, or other reasons such as trying to save money away from home, had side effects, was too busy, RX wasn't working, didn't think RX was needed, or didn't like taking it. Now, the last three, and then that's the one that I want you to take a look at. RX wasn't working, didn't think RX or prescription was needed, or didn't like taking it. Now, those three, they're kind of in the bottom of the list. They're not as frequent as, say, for example, forgetfulness. I mean, people always, forget things, right? I mean, that's normal. But when someone is not taking medication as intended because they believe it's not working, and then, there are multiple causes for it. And if you go to the previous slide, high cost of medications is one of them. Believes that treatment is unnecessary or working is another reason. Too many medications, complexity of regimen, confusion because of too many medications, another reason. Side effects and adverse drug reaction, yet another reason. And in some cases, lack of knowledge, lack of education, literacy, etc., are reasons underlying this non-adherence problem. Like I was saying, it costs about $100 billion to the American healthcare system. $100 billion. Okay, that's twice as much as what we in India collectively spend on prescription drugs, all of it. Now, one thing, however, that I want to acknowledge, that maybe comparing prescription drug spending in India and USA is probably not a smart thing to do. As you used to say, no, in India there is price control, and in America there is no price control. According to the drug price control order that was passed, I believe, in 2013, 7 years ago, in India there may have been updates to that. There are about 300 medications that are strictly placed on price control in India. Now, that may be one of the reasons why the drug budget or the pharmaceutical spending may be lower in India than in other places. Having said that, though, I have some data for you. Can we switch, skip a couple of slides and then go straight over to that print article, if we can? And I'm gonna maybe pause with that, and then see if you have any questions, because we don't have a lot of time left. Unless you want to extend, and then I'm more than okay if you want to extend it, but I don't know if your audience wants to stay. If you could skip over to the part about medicine prices in India, there is a chart that, yes, thank you for that, yes. I'm going to leave that on the screen, and then let me finish my thoughts about medication non-adherence as priority area number 2. So some of the problems that we witness every day may not be a problem at all in India, okay, such as, for example, high cost of prescription drugs. But when you consider the very nature of these pharmaceuticals, because nearly all drugs have side effects, nearly all drugs, if they're not taken as directed, have toxicity, or most drugs have contraindications. So there is potential for problems with these drugs. So the question is not we are spending too much on these drugs, and you may not be in India, but we are here in America. But the question is, are we making sure that whatever the medications that our patients are taking, are they taking them in a safe manner? Okay, safe use of medications, that's what this is about, right? So the next priority area, which I'm now going to talk about in the interest of time, is about all of that. So I was able to cover only 2 training areas, and I'm going to pause for a moment to see if you have any questions, or you want me to stop. But other than that, I apologize for not finishing this presentation in a timely fashion because of the technical issues we had. But I welcome you all, now that you have my contact information. If you have any questions about this presentation, or if there is specific thing that you want to explore or want to talk to me about, feel free to email me. I'll be more than happy to engage you in a conversation. So I look forward to interacting with you in the future as well. So I want to thank you for giving me this opportunity. Unless you wanted me to continue, I'm going to treat this as the conclusion of my presentation, because I think we have only about 2 minutes left. So let me open it up to Q&A and see if your audience has any questions. Or Dr. Shailaja or Dr. Archana, if you want to ask your audience, they have any questions, or I don't know if this is at this point, if this is carried live or streaming live.
Sir, you finish your presentation, sir.
Are you sure?
Right. Sure, sure, sir. You can take 10 more minutes and you can conclude.
Okay.
Because
all right.
only few slides are left, so better to finish the presentation.
Okay, because I was rushing through these slides because I felt like maybe I'm going too fast.
At least,
but okay,
you can go a bit
still
fast
going in that
try
case.
to come.
Okay, I'm still going to skip a few slides, just again because I want to finish it in 10 minutes time, and then see if you have any questions. Well, thank you for extending it. So yes, so let me switch to area number 3. So I'm going to skip this. I might spend a couple of minutes on the slide about medication non-adherence, proposed intervention that could involve pharmacists. If you could go back a slide or two, could you maybe, the one before this, I think, not this one, and not the one, yes. Okay, this is the title of the slide, medication non-adherence, proposed interventions that could involve pharmacists. That's the one. Yeah, I want to talk about that for a minute. Okay, not the tech-based opportunities, but medication non-adherence. Proposed intervention that could involve pharmacists. If we could go back to that just for a second. I just want to make a point that there are tremendous opportunities in this area, particularly addressing the problem of medication non-adherence. Not that one, another one before that. Medication non-adherence, proposed interventions that could involve pharmacists. That's the title of it. There. Okay. Thank you very much. All right. Yes. Now, if you see some of the things listed there, and then many of these things are pretty standard, meaning you may be already doing it if you're a hospital pharmacist, like patient education or medication regimen management. But some of those things, some of the other things may not be common, such as, for example, cognitive behavioral therapies or using incentives to promote adherence. Now, the point about this particular slide that I want to make is when I said there are opportunities in this area for pharmacists everywhere, not just in the United States, even in India, because this is where you are actually leveraging your clinical skills. Okay, this is also where you may be leveraging your management skills or marketing skills. And if you could move on to the next slide, to tech-based solutions. And a lot of entrepreneurs, people who are business oriented, are investing a lot of money in medication non-adherence research. It is today, it is kind of considered a gold mine for pharmacy entrepreneurs. Gold mine with respect to what? Well, with respect to technology that is already out there, but also newer ways and means of addressing the problem of non-adherence. And people are constantly coming up with new technology-based solutions for this. And I mentioned a few of them, using smart pill bottles, smart package systems, smart pill dispensers, and bioingestible sensors. They've been around, but they're also becoming more popular. Now, the point that I want to make about medication non-adherence, particularly the future pharmacist, there is this area which it kind of interfaces with the technology. So this is sort of like the amalgamation of medicine and technology. And if you happen to have expertise in that, okay, or you happen to have interest in that, then this would be one area I implore you to explore. This is one area I urge you to explore. And then I just say look more into it, because a lot of technology is already being utilized, in Europe and in North America. I do not know how popular some, like, for example, e-prescribing or electronic health records are in India. So something that definitely you should take a look at. And maybe someday in the future, I'm happy to talk to you about that as well. Now, one last area that I want to quickly go over is the practice area 3. If we could switch to the pie chart, the picture, pie chart with problems associated with medication therapy and models of care. Now, to put things in a perspective, and this is sort of like the bigger picture. If you look at this chart, medication non-adherence is listed as well. But if you, and then this is, reporting on the research that was done by ACCP, American College of Clinical Pharmacy. And then they actually published a report, and all the information about, their research, and also the title of the publication is all at the bottom of your screen. And one of the things that they discovered, interesting findings, was that medication therapy problems, you kind of break it down into many different areas. The significant one, 56.86%. Okay, the significant problems were in the area of inadequate therapy. Now, that's kind of broadly defined because there is medication non-adherence, which is only about 15% of the time. And that was what was being reported as a therapy-related problem. Adverse reaction is another 15%. And a dose too high, unnecessary therapy, about 6% each. But a big chunk, a big portion of medication therapy problem was that inadequate therapy part. And then that's where opportunities lie. And in my PowerPoint, I talked about 2 models, MTM, medication therapy management, something that I believe, pharmacists in India, even in pharmacy schools, students have heard about. It may have a different meaning and different definition in India as opposed to in the United States. But as a practice model, as a practice philosophy, okay, as a technique, they are still the same. So whether you call it MTM or something else, because earlier today, one of the organizers mentioned pharmaceutical care, right? I mean, that's something that's mentioned a lot, and that's the older, and I might say older model of pharmacy practice. But today, where we call pharmaceutical care, and I give it a different name, we call it medication therapy management, collaborative care models. Now, under collaborative care model, the one that I chose to discuss was one that's called CMM, comprehensive medication management. So there is MTM and there is CMM. So who are the people who need these specialized or high-level pharmacy-based clinical services? Well, these are the people with problems, and then all the ones that are listed, for example, patients who are not reached or not maintaining the intended therapeutic goal, patients who are experiencing adverse effects, patients who need preventive therapy, patients who have difficulty understanding and following their medication regimen, and patients who are often admitted and readmitted to the hospital. Now, if you think of these people as the priority population, and there may be other people as well, but these are mostly the target population that pharmacists can deliver MTM and /or CMM, okay, comprehensive medication management services. So you're looking at MTM as a model, and it is kind of holistic. And if you look at the picture, and you see pretty much everything mentioned in there. It says a service or group of services, service or group of services that optimize therapeutic outcomes for individual patients. It is a term used to describe a broad range of healthcare services provided by pharmacists, the medication experts on the healthcare team. So there are a couple of things here. It is a team-based care model. It is focused on outcomes. And it is also about optimizing therapeutic outcomes. And it covers a broad range of services, everything from medication therapy to immunization. Okay, so that's MTM for you. And I wish I could tell you more about it, but instead I'm going to skip to the other picture. Can we skip to the the CMM model? And I want to show that model and then conclude if I can. CMM, Comprehensive Medication Management, the practice framework. Okay, that's the other model. Now, if you're wondering what's the difference between MTM and a CMM, well, conceptually they are related to one another, except CMM is exclusively focused on medications alone, and medication therapy management, MTM, even if it's called that, it is more holistic, it's much broader, and it covers a wider range of services. All right, so now the final point that I want to make about it, now if you could move to the key lessons learned so far, the last two slides, and I'll quickly go through the list of things that we can treat as lessons. Can we switch to the next slide, please? Key lessons learned so far. Yes. What did we learn so far? I'm going to kind of skipped a few things, but I think the underlying message is clear. Pharmacy practice is continuing to evolve, and globally it is expanding, and pharmacists of the future are expected to do more with less. And also they're given, importantly, the privileges and authority to perform, special functions. And that's possible because of all the changes in laws and regulations and so forth. So much of it is really good news. But what we learned so far, pharmacy practice of the future is going to be mostly interdisciplinary in nature. And the practice should be more readily adopt public health orientation. So which is the reason why I gave you examples of immunization in the pandemic care, because those are public health focused, pharmaceutical care, if you will. And therapeutic approaches are going to be mostly team-based, coordinated, comprehensive, and customizable. More service orientation and less product focus, more population-based than individual-focused, and evidence-based and protocol-driven. So may involve a non-traditional partnership among different participants and players in healthcare, such as public health, industry, academia, healthcare, local government entities, etc. And finally, the current evidence shows that the expanded models of care are cost-effective and deliver better care in population compared to older traditional models of care. Now, here is really, what I want to say in a nutshell. So what we learned so far is that practice model is continuing to evolve. The vision of pharmacy for the future is changing, and then it's becoming much broader. But there are also more opportunities than ever before. Some of it is due to the pandemic that are being created for pharmacists, and we should take advantage of them, provided, however, that we are properly skilled, we are adequately prepared to do some of the things that are listed here. For example, being able to participate as a member of a team that consists of professionals in other disciplines, being able to participate and develop partnership with other players such as health insurance, academia, industry, and so forth. Being able to be more service focused and perhaps less product focused. And I'm not saying ignore the product or completely disregard it, but the focus is changing. We should be more service oriented. Okay. So team-based care, comprehensive care, service-oriented care, that's really going to be the future of pharmacy. And as long as we understand that, and then try to kind of adopt that as a practice philosophy in the future, I think we will be in a great shape in the near future. So we really don't have to wait too long, because in India we have the necessary educational infrastructure, we have resources, we have talent. We can be there. So the purpose of this presentation today was to kind of share some of my thoughts about it, and then also to make you think about what's possible, and also hopefully draw parallels between what's happening in the rest of the world, globally speaking, and what could perhaps be done differently in India. All right. So those are the conclusive remarks. So I'm totally optimistic. I have nothing but, positive and extremely bright outlook for what you guys, the future pharmacists, can do in India. And I'm always ready and available to help you in any way I can. So feel free to contact me, email me, and then also you can find information about me online. Other than that, I want to once again thank you for the opportunity that you've given me to spend an hour with you. And then I hope this was a productive experience for you, as it was for me. So with that, I'm going to conclude and see if you have any questions.
Thank you very much, sir, for wonderful presentation. Our audience really liked your talk. They expressed their thanks towards your lecture. And there are few questions, sir, from the
Sure,
audience.
absolutely. I'll be happy to try and answer them. Go ahead.
So, can you explain about exams to be written in order to become a registered pharmacist outside India? This question is from Tejaswini.
Okay, Tejaswini, exams to be written in America, right? If I understood your question correctly, in order to become a registered pharmacist in the United States, there are several steps that you have to follow. The first and foremost, and the one that Professor Sumakan talked about, which is, a 6-year PharmD degree, unless you graduated with a pharmacy degree from India before 2004, which is really a long time ago, right? If you graduated after that, and as long as you have a PharmD degree and you have the transcripts to prove that you have, the PharmD, the expanded degree, then first step is sitting for what is called the FPGE, Foreign Pharmacist Equivalency Exam. Now, as a pharmacist coming from India or China or Korea, wherever else, all foreign pharmacists, if they can show the proof of all the credentials, meaning the degree, the transcripts, and all of that, then the first step is taking that exam. And the second step, and again, remember, as I said, it depends on where you want to practice. If you want to be in New York, as after you take the exam, you also have to do what's called internship. And this internship, and then depending upon whether it's New York or New Jersey or Pennsylvania or Texas or whatever the other states might be, this internship requirements vary from state to state with respect to number of hours. So as an intern, for example, in in New York, you may have to work as an intern for more than 1,000 hours, as many as 1,200 hours. Okay, so that's a New York requirement. It may be different for another state, but it may be even double that for certain foreign pharmacists. Now, as an example, that's what I'm saying. If you're going to be a pharmacist in the United States, the first step is taking that foreign pharmacy equivalence exam. Second step is doing internship, the required number of hours, depending upon where you're going to practice. And the third is taking the board exam. That's called the NABP, National Association of Boards of Pharmacy exam. Now, if you Google NABP, okay, National Association of Boards of Pharmacy, you will see all the details there. And then you can also Google or just simply type in nabp.org, and that will take you straight to the site that administers all these exams for candidates from abroad and then candidates that are trained here. So there are 3 steps. And as long as you successfully complete these 3 steps, one is FPGE, second is internship, and the third is another exam, which is a much harder exam than FPGE. National Association of Boards of Pharmacy, called NAPLEX exam. NAPLEX exam stands for North American Pharmacy licensure exam. So FPGA, internship, and NAPLEX. You do all three, then you're ready, right? Provided you have all the necessary credentials even before you take all those exams and then do internship. Does that answer your question, Tejaswini?
Yes, sir. Sir, there is
Okay.
one more question from Subbarao, sir.
Sure.
What is the cutoff point if they want to get admission in your university, St. John's University, for TOEFL, GRE?
Yes, we have GRE cutoff, and then I'm speaking for myself. When we have a policy, like all universities do, all different programs do, and generally the cutoff is about 1100 verbal and quantitative. That's something that we look at more closely. But then, personally speaking for myself, I'm not speaking for my colleagues because we look at these applications as a committee. Okay, we individually review all these applications. Then we get together as a committee and then decide, who's the candidate, who's the application that's the best. So we sort of compare one application with another because in many ways it's a relative sort of assessment. It is not absolute, but to an extent it's absolute. There is GRE requirement. There is a recommendation letter requirement, like 3 letters of recommendation. In GRE of at least 1100. And I know most students who apply from India don't have any problems speaking English, but TOEFL or equivalent test of spoken English. Okay, there are different programs or testing programs that you can find more information from our St. John's website. I'll be happy to share that with you as well. Having said all of that, okay, there is GPA, there is recommendation letter, there is experience, there is GRE. We look at all of that. So GRE alone, if you have excellent score in GRE, to me, yes, I'm always impressed with a good GRE, but I also look at other things, other accomplishments, right? What you did as a student. Did you do any presentation? Did you publish a paper? Or did you attend conferences, right? And there is something else called statement of purpose. And then some of you may be familiar if you have applied to foreign universities. And statement of purpose is simply an essay where you talk about, why you want to be in a specific program, what your goals are, and what you want to be after you graduate. And then also, it is sort of like your vision for yourself and what you want to do after you get your degree, whether it's master's or PhD. So there are all different things, and there are multiple components to it. But because your question was about cutoff, about 1100 is what we're looking for, verbal and quantitative. And as far as I'm concerned, when I review these applications, I don't pay too much attention to these cutoffs because a student may be extremely strong in quantitative but poor in verbal, or it could be the other way around, strong in verbal and not so strong in quantitative. And you may still land 1100, right? So I don't, because different professors have, different ways of looking at these things, they assign different weights to these things. Personally speaking, to me, GRE is not as important as GPA. GRE is not as important as statement of purpose. And GRE to me is not as important as other things like curricular or co-curricular or even extracurricular. I look at all of those things. But, again, you're welcome to visit our website where all the specific details for applying to our university is clearly laid out, but you're still welcome to, if you still have questions, feel free to email me and I'll be happy to answer them as well. Okay, here is another question,
Yes,
I think, on the screen. Can I read it, Dr. Shailaja?
Yeah. Yes, sir.
Okay,
What are the trusted areas of research
yes,
in hospital training?
Yes, what are the trust areas of research which can be done during the hospital training related to pharmacy practice or medication therapy management? That's an excellent question. Well, there is no template for this. Let me put it that way. And one of the things that I always tell students is it's always good to see, what is really considered desirable or hot, or what is in current circulation today. For example, everything or anything that has to do with pandemic here is kind of in vogue, and people want to do research in that area. But my strong advice to you is, if you want to do research, okay, well, yeah, try and explore different areas out there, and then see the ones, which ones are the ones that are in high demand, because that makes sense, from the standpoint of you know um, career pursuit, or finding the right career for you. But at the end of the day, I see research, because you asked trust area for research. At the end of the day, I see research as something that you have to be passionate about. So, for example, and I can only give you, my example. Uh, my research areas are it's more than like two or three. The one that really fascinates me is anything that has to do with chronic disease management in elderly. Okay, well, for a simple reason that, elderly, the senior, the older people consume more medical resources than younger people, right? They also tend to have multiple medical conditions. They also tend to have more problems, medication related, right? So to me, a research in the area of elderly chronic disease management, and then also I do a lot of research in, economics, socio-behavioral, marketing, and outcomes related. To me, that's interesting, and then to me, I'm also passionate about that. So my advice to you, yeah, there are some key areas, and then again, it depends on whether you want to be in basic science, or because you said pharmacy practice, so I'm guessing that it's going to be. I know you're talking about clinical, right? So clinical pharmacy is not exactly my area of expertise. What I teach in our master's degree program in pharmacy administration department is things like management, administration, marketing, economics, outcomes research, consumer behavior. And I also teach similar courses to our undergraduate PharmD students as well. So as far as clinical pharmacy is concerned, I'm really not an authority in that area. But my advice to you is, do some independent research on this, and then look around, see what is today considered really high demand areas of research, and then go from there. But importantly, if you have passion for something, okay, either because if it has perhaps personal relevance to it, okay, someone in the family maybe has diabetes or hypertension or maybe cancer or something else, and you may develop interest, particularly in that area because of that personal relevance that I just mentioned. So there are various ways to go about this, but the most important thing is find out what you have strong interest in. It's even better if you're passionate about it, because then not only you're going to do well, you can never fail. You're going to succeed. So that's my advice to you.
Okay, sir. There is one more question from Archana madam.
Absolutely.
What are the various courses, PG diploma courses, and what is their scope in the field of pharmacy practice?
PG or PG diploma courses in different areas of pharmacy practice. If so, what is the scope of those courses? It's interesting that you asked that question, because the most PG, and in the literal meaning of that, postgraduate, we don't call them courses per se, but we call them training programs. Now, there are PharmD graduates who might be interested in, say, for example, public health. So one of the common areas that is, most graduates have strong interest in is public health. One of the reasons I talked about that today, population health or public health. So there are master's degree program in public health, right? That's one PG option. But to be honest with you, most American students, once they get their PharmD, they enter practice. Instead of getting a PG degree, what they do instead is do PG training, postgraduate training. And the common ones that I can give you examples of, one that has to do with certification, something along the lines of residency or fellowship. So residency, fellowship, and certification. These are the three options as PG. The reason that many students don't go for another say a master's degree, because there are students who may actually do MBA. I see that a lot. And some students also may want to be lawyers and then get a degree in law, and all those things are possible. But from the practice standpoint, the one that really matters is for a pharmacist in the United States is post-PharmD. That's what I'm talking about, right? A residency training, fellowship, and certification. Now, these are the common PG options out there. And when you say certification, well, there are at least a dozen different areas. You can choose to be certified in a specific area, say, for example, pediatric pharmacy, or oncology, or pharmacotherapeutics, or nutritional pharmacy, right? So there are multiple areas that, again, depending upon your aptitude, your interest, your expertise, and so forth, you can be certified in any of these areas, more than one. For example, geriatric pharmacy is one that is really popular today, geriatric pharmacy, right? Oncology is also pretty popular, and ambulatory care. So there are different directions that you can go. And if you're going to be a PharmD, and then you want to do a PG, and you want to practice in the United States, then I suggest, if it's possible, sure, go ahead and get that MBA or MPH, as in Masters in Public Health. You're welcome to do that, but it may not be a good investment of your time, because if you want to be in practice, then these are the things that you want to pursue: fellowship, residency training, and for a foreign pharmacist, however, this may not be easy, and I must tell you that as well, which is why many pharmacists that come from India, unless they do PharmD here, right, may get a master's degree in public health or pharmacy administration or something related, and then maybe still work as a pharmacist. But if you want to be a successful pharmacist, then particularly in clinical pharmacy, then I suggest that you explore those things. Thank you for asking that question, Dr. Archana, because that's something that I think pharmacists from India have to know more about.
Hello?
Okay, there is another question I see.
Sir,
so
Sripanna is asking a question, sir, regarding the
how monitor
medication
adherence
adherence in
geriatrics
geriatrics.
taking multiple medications, any method to monitor? Okay, well, that's another great question. One of the things, because you're asking about geriatric medicines, one of the common problems with the geriatric medicines is polypharmacy, and I'm sure you know what that means. One of the common problems is mixing too many drugs, or what we call in pharmacy language inappropriate medication therapy. That happens more in geriatric population than any other. Like, for the reasons that I just explained, they're older, they take more medications, they have more medical conditions, so their medication regimen happens to be complex in most cases. So helping them out, particularly if they are non-adherent, what are the techniques or solutions that are out there? Well, when you talk about solutions, there are technology-based solutions, and then there are intervention-based solutions. And if you're wondering which one is what do I, which one should I be interested in? The technology-based ones are the ones that I mentioned today, right? Using medical apps or using high-tech tools or gadgets. There is that. Then intervention-based, non-adherence, addressing problem non-adherence would be strictly to intervene and perform necessary clinical services, such as, for example, drug utilization review. Now, one of the things that happens, and this is called, by the way, for your information, if you want to look that up, in pharmacy literature, it's called DUR, drug utilization review. Now, drug utilization review is a process where you review medications for everyone, but DUR is more common in geriatric pharmacy than any other. For example, in nursing homes here in New York, by law, pharmacists have to perform DUR once a month, mandatorily. That's a requirement. All right. So DUR is another way you can intervene and address the problem of non-adherence. So there are different ways you can address this problem. I know I can talk more, but let me see. There's another question. Yes.
Yeah, current state of job market for PharmD students in USA.
I wish I had uplifting news for you about that. I remember back when I started teaching about 20 years ago, there was such a huge shortage of pharmacies all over. Okay, not just New York, not just New Jersey where I live, but everywhere. But that shortage is more or less gone. And part of the reason that shortage is, happened in the first place was because just like in India, we moved from a, bachelor's 4-year degree program to 6-year PharmD, right? They kind of created a bottleneck in the supply. Suddenly there were fewer graduates entering the workforce, right? Because they were spending more time in school, spending 6 years. So that created a supply shortage. And for many, many years, until I would say 2015, 16, 17, until 3 years ago, that shortage persisted. But over time, that shortage eventually went away. There is still some shortage in rural areas, some places where nobody would want to go, right? There are those places, but to answer your question, let me put it this way: the job outlook, the market today is not as good as it was just a couple of years ago. Now, there is one silver lining to this. A pharmacist who goes beyond just a PharmD, and like I said, who has additional training such as residency and certification, things of that nature, there is always demand for that sort of expertise. So if you're going to come here, be another PharmD, and you want to work in retail, it might be really, really hard, if not impossible, for you to find a job. Because I'm hearing my friends who own pharmacies and my colleagues, who are familiar with this, they will tell me, there are more applications than there are positions available. And this is happening everywhere. So I'm not trying to discourage you at all. I still want you to try, but I think your chances would be a lot better if you have some additional training beyond PharmD. Now, is that going to change for the better? Okay, well, not in the foreseeable future, right? Because nearly for over, dozen years, we had this problem, and pharmacists were able to find employment easily, but it's not as easy as before. That's the current
Thank you
state of
very
job
much,
market
sir.
for you.
Yeah. But people are, whoever completed PharmD, they will be thinking that they will be getting good opportunities in abroad.
Well, it's possible. Like I said, I'm not going to rule it out, but I think they probably have to work harder than PharmDs here. I'm going to be honest with you about that, because there's always preference given to, and then given to a pharmacist who's trained here, right? When you're in the job market applying for jobs, unless there is that acute shortage and they desperately need pharmacists. And that was the case. I remember back when I was coming out of graduate school, they would offer me thousands of dollars of bonus and they'd say, come work for us. We will take care of your mortgage. We'll take care of your, if you have any student loans or auto loans, we'll help you with that. But that's no longer the case. Today, you're competing with everyone else, and those terms are not as attractive anymore. And if anything, there are some indications, because as you know, I'm sure you've heard, pharmacist is one of the best professions as far as income potential is concerned. An entry-level pharmacy degree fetches you anywhere from $120,000, $130,000, and then that's the median salary. The compensation numbers are really good, but there is a lot of competition even for that. So the only way to differentiate yourself, and if you're in the job market and you're competing with not only graduates coming out of American pharmacy schools, but other graduates just like you, then you have to differentiate yourself, and then you show them that you have other extra, special qualifications that you bring to the table. But having said that, I'm not going to absolutely not discourage you, because there is always a job to be found. You just have to look harder than before. That's all I'm saying.
Thank you very much, sir, for answering all the questions. Thank you very much for accepting our invitation and
Absolutely.
spending your time with us. Really, today's session is really wonderful. All the audience enjoyed, and they conveyed their thanks to you through their postings. Thanks
I'm
a
more than
lot,
happy
sir.
to. I'm more than happy to stay and answer if you have more questions. I don't know what your timeline is, but I want to thank you for giving me a chance to talk to your students, because
Our pleasure, sir.
This is a good experience for me as well. Yeah, this is how I keep in touch with my home country and all the pharmacy affairs in India. That's another reason why I wanted to do this. So thank you for granting me this opportunity once again.
Thank you, sir. Thanks a lot.
All right.
Thank you, sir, for such a wonderful presentation.
My pleasure.
There is a small announcement. The feedback link for the first session is displayed in YouTube chat box. All the delegates are requested to fill the feedback form of the first session. And the next session of the webinar is on career path in pharmacovigilance by Mr. Murugan sir, which will commence from 1:30 onwards. So all are requested to join the session again by 1:30 onwards. Thank you everyone for your time and patience. Thank you.